Hey, welcome to the Pharmacy Residency Podcast. I'm Tony Guerra, and today I have Dave Chatterji, who is the current Residency Program Director at Inova, Fairfax, Virginia. He is a former Residency Program Director at Georgetown and the Residency Program Director for TLDR Pharmacy's own Brandon Dyson. So welcome to the Pharmacy Residency Podcast.
Oh, thanks for having me.
Okay, well, I first wanted to get a little bit of background on you. When you got out of school, I know maybe there's a couple years lag, but what made you decide to do residency, and then what was your initial residency path, PGY1, and so forth?
Sure. So I graduated school at the University of North Carolina, so I'm a diehard Tar Heel fan. What sort of led me to pursue residency training is, and that was a good while ago, but back in the day, it wasn't something that I had decided for my P1 year or anything of that nature. So actually, for me, as I started rotations, I had a couple inpatient acute care hospital rotations, and speaking with preceptors and just wanting more experience, to gain comfort as a clinician, and things of that nature. I hadn't worked in a hospital setting either as a technician, so it was just unfamiliarity with the hospital setting besides just rotation. So I was encouraged to look into pursuing postgraduate residency training, and that's sort of what made me look at it. So that's how I got to where I was. So I did my PGY1 residency program at Georgetown University Hospital. It was a very small class size at the time, but it was a great experience. I think my learning curve was quite steep, and it's just it's baffling how quickly and how quickly you develop that sense of responsibility, autonomy, comfort level just within a few months. So.
Okay, well, let's talk about the day you got licensed, because I know DC takes a little bit longer, and so one day, your own RPD is sitting there looking at you, and you're going, "Yes, I passed," and you're like, "Great, okay, here's all this other stuff to do." Tell me about that day and how things kind of changed from, okay, I'm doing orientation, I'm doing some things, and now I'm licensed. What happens there?
Sure. So yes, DC is a very difficult place to get licensed. I was a fully licensed pharmacist in North Carolina prior to starting my residency. In DC, by the time the board approved my application and everything, it was almost September. So for the first couple months of my residency, and then I had to take the law exam and whatnot, I was essentially inserted into the system as a technician. So I'll say from both standpoints. From a clinical standpoint, your first month you're on orientation and training, and I was like halfway through my first rotation before I got licensed. So either which way, you're sort of a glorified P4 during the first rotation of residency. So
Okay.
it wasn't. It didn't seem too much of a difference on that end. The difference was when I did get licensed, I got taken off the sort of technician status in our pharmacy system, and actually I didn't have to have any of my orders that I was verifying be verified by another pharmacist. So that put a little scare inside of me because I knew there was no one to actually back check anything that I was doing.
Okay. All right. So now you've gotten licensed. You're in Georgetown. You're a couple months in September. Tell me a little bit about how rotations work for maybe somebody that's not familiar. If you can compare them to APPEs, or you can't, I just don't know. I've been in community most of the time, so I'm really not as familiar with hospital rotation.
Sure. So with hospital rotation setups, it's usually every program is going to be a little bit different, but most programs will have a sort of quote-unquote curriculum that you follow, and my residency program was no different. I had certain required rotations and then a number of electives I could choose from. Depending on preceptor availability and the class size, they generally try to make it a little bit more in sort of a way that you progress accordingly. So I started off, for example, I didn't start off in a critical care unit just from the get-go. So most programs will have you start off on a more of a medicine type service or a non-ICU type service. So I actually remember starting out in general pediatrics, followed by adult internal medicine, and then about my third month in, I went into critical care. And those are typical required rotations from a hospital setting. You'll do some sort of acute care that's non-critical care, then you'll generally have a critical care rotation. And then what ASHP generally recommends is that you make your required rotations more so where you have your best preceptors and teachers, not necessarily following a thing of saying that you have to have XYZ rotations in a residency program, because the whole idea of PGY1 is to give residents a skill set, and a modality of how to practice, or teach you how to practice. Not necessarily become an expert in a particular topic area per se. So it's supposed to give you the skills to be able to practice independently. So that's essentially how rotations are selected. So it generally follows somewhat of a curricular fashion, but then also it's where you have your best teachers.
Okay. And you mentioned at Inova, Fairfax, you have PGY2, so some residents have to make that decision about early commit, I think October or November at the latest.
Yeah, it's quite early. I think October 1st, if I'm not mistaken, is the early commit deadline.
Yeah, so what advice do you have for those guys? Because it sounds like they may get one rotation with their specific interest, oncology or something like that, but really it sounds like it's more about feel and if they want to be there another year and if they want to have you another year. What advice would you have to them?
Yeah, absolutely. I think especially bigger programs with a large number of residents, it's sort of hard to get in that rotation right before the October block, essentially, because if you think about it, if you're at your site, be like, depending on what's going on, if you're interested in staying on.
You've been at Georgetown for a while, and then you made a move. I remember going down to Georgetown Hospital and just walking through Georgetown and like, oh, that's a nice townhouse, and it was for sale, and it was like $9 million. Tell me a little bit about what maybe made you move from D.C. To Virginia. I'm from the Maryland side, so I know Montgomery County and the Red Line on the Metro, but I'm not as familiar with, I think, what is the Orange Line? Is that right? I think.
Yeah. Nice, yeah. Okay. Northern Virginia mostly is on the Orange Line. Yeah, so even while I was at Georgetown, I lived in Arlington.
Okay.
So I wasn't, compared to most DC folks or DC Metro folks, I didn't have too terrible a commute.
Okay.
So I lived in Arlington, like the south part of Arlington. Then we moved into the north part of Arlington. So when I made the move over to Nova, it wasn't my commute got a lot better, but it wasn't necessarily more so for commute. So making the move over was just a career change, just to see something else, because I had been at Georgetown since I did my residency training there, and then stayed on staff there afterwards.
Okay, and is that something that's common? Is staying on staff something that usually happens, or is it like professorships where they prefer to get somebody from somewhere else? I would think it's the former, but I just don't know.
Yeah, I would say the former is definitely true. Nowadays, markets in different areas are more saturated than they were back when I finished training. Okay. So, sometimes it's a little harder, but I think residency programs or hospitals would like a mix. Definitely if a trainee is interested in staying on, and we're able to keep them, then we would definitely want to do that.
Okay.
Because you don't have to retrain them. It's expensive to train pharmacists, and I know at Inova our training period is 6 to 8 weeks. That you have to have them be double backed on the schedule, or you've got someone else training them. Versus if we keep on one of our residents, they can start from the get go.
Oh, okay. All right, cool. All right, well, tell me a little bit about the showcase experience from your experience as a 2B resident first, and then we'll talk about RPD, because I think that have you done the showcase as a student, a PGY1, a PGY2, and an RPD?
Yes, so I did the showcase as a fourth-year pharmacy student going on seeking PGY1.
Okay.
And then I've done the showcase as an RPD for, I think, 8 times now. So
whoa,
tons of experience.
Okay.
So first as a student, I will say that was the first time I saw the showcase, and it was just as much of a zoo back then as it is nowadays.
Okay.
And that's well over 12, 13 years ago. So as a PG, as an applicant seeking PGY1 programs, I think it'd be quite important to, make some sort of schedule or have some sort of idea of what programs you're gonna try to hit. The whole idea of the showcase is to just gain information. If you think about it, and the number of people that residency program directors and preceptors are going to see in a given 3-hour time period, it's going to be, it could be upwards of 100 people. So they're not going to remember every specific person. So I wouldn't expect, I wouldn't go into the showcase expecting to have this, long, great one-on-one conversation with your next RPD. It's mostly information gathering, and you want to make sure, you don't do anything on those sides that's going to make you sort of stand out in a not so good way.
Okay. So no suits like Dumb and Dumber or anything like that. The blue suit,
exactly,
the orange suit. Okay.
Exactly, because that's going to be something we remember.
Okay.
But outside of that, it's you want to be engaged. Ask good questions. It's information gathering, so you want to be somewhat. Obviously, I think schools are training prospective applicants very well now, but it almost looks like, speaking from the RPD side, I see students come and they almost have like a legal pad with, a check mark of questions that they're asking, and sometimes they won't even like look up and look me in the eye. They're just kind of get all their questions answered. So, which is fine. I get that that's what the goal is to get some information, but then you realize that they're not as that personal aspect of it is sort of gone.
So when they come to the interview and you see the top of their head, you're like, "Oh, I do remember you." Okay.
Yeah, exactly.
All right. So you're. Let's talk actually a little bit about the. So there's the showcase, which is a zoo. There's thousands and thousands of people. But do you go to your alma maters? I don't know exactly what they call it, but basically every school or most schools have kind of a little gathering, maybe bring the alumni together and students and all of that stuff. And when I went to the Maryland one, I remember, oh, look, there's 2 residency program directors, which students would have killed to have seen, during the day without the zoo. Can you talk a little bit about those, or do you just like call it a day after your 3-hour shift?
Oh, no, not at all. So most alma maters or most schools of pharmacy will have some sort of reception at ASHP.
That's the reception.
Yeah, often at the showcase itself, you'll be encouraged. Sometimes if it's an open kind of invitation and it's not like a closed up party, they'll be like, "Oh, you should come, come see me at the showcase," or come see me at the reception, because then you're getting them in, a little bit of you get a little bit more personal time with that person, because as I said earlier, the showcase is such a zoo, is that even as program directors, you're just talking a mile a minute, and you're going from one person to the next very quickly, so you don't really get to sit and get to know anyone. So sometimes I've told folks, even especially if they're going to be, I tell them, "Oh, I'm going to be at the UNC reception if you're going to be there," and you can see from their badge what school they're from.
Oh, okay,
like,
sure.
come see me if you're going to go to the reception. Come see me there. I'll, I can chat with you. We've done that for our own residents who are seeking PGY2s. If we know a program director, we say, "Oh, go to that reception. Go talk to them there." So.
Oh, definitely. What about I don't know how to put this, but so the program directors are certainly going to go get a beer, or maybe they're not. But I'm just saying that there's a definite relaxation that a program director might have that an applicant hasn't really earned yet or can't really have quite yet.
Sure.
Any recommendations on how to not be awkward? Because you probably want to hold something, maybe food or something, but I don't know. I don't even know where to go with that one. But how does a student behave, I guess, in that arena? Because it's supposed to be social, but they're kind of constrained a little bit.
Yeah, I mean, I think a student should use their judgment. I don't personally think, I wouldn't think anything less of a student if they had a glass of wine or beer with him that they were holding, especially at a reception where the idea is to be social, especially if you're going to your school's reception and you're mingling with your classmates and things of that nature. I don't think there's anything wrong with that. With that said, there is a degree of professionalism. You don't want to be kind of on the sloppy side of things when you are at that reception, because yes, there is an opportunity to professionally network at those receptions as well. My general advice would be that most schools, if they're going to be offering alcoholic beverages, usually give their students and all attendees like a drink ticket, because that's what my school does, and you usually get 1 or 2 drink tickets. And so that would be a good gauge to be like, don't go beyond that and collect other people's drink tickets and use it as an opportunity to have more.
Oh boy. Okay. All right.
So Inova Fairfax is what is technically designated as a large community teaching hospital. Okay. So we're not on a university campus per se, but we do have definite academic affiliations. Within Northern Virginia, we're probably the largest hospital, so we're about 1,000-bed facility.
Holy moly.
So we see a little bit of everything. The thing I tell prospective residents is that you sort of get the best of both worlds at an institution like ours, is that since we are a community hospital, that means that we have a lot of private physician groups and all that who have privileges at the hospital, as well as sort of Inova-owned practitioners as well. So some rotations will be very typical teaching services that you would have at any other university hospital, where you have 3-hour rounds, there's medical residents, pharmacy residents, students, fellows, et cetera, et cetera. And then there'll be other rotations where it's primarily, a pharmacist, a physician, maybe a physician extender or something like that, and it's much more of a work rounds type environment. So both are learning environments, but at least you get to see both sides of things. And then you understand the nuances of what it's like to be in a community hospital, but you could also definitely train at our institution and be very comfortable in a pure academic type setting.
Okay. Well, I've asked you a lot of questions. Is there anything else that you would want to tell people about the whole residency process? Maybe something I find that they're a little bit high strung. Is there anything that you can talk about to just help them chill out a little bit?
So that would be my advice, is to chill out, be a little relaxed. My biggest advice would be just not, and I know it sounds cliche, but just sort of be yourself, be normal, don't come off as robotic. Because I know you got your list of, students have their list of things that they have to ask and all that, but if it seems very robotic, then it sort of takes away from that, the personableness that trainees are looking for. And if you think about it nowadays, most pharmacy students who are pursuing residency, we know that you all are smart, you're obviously finishing school with a doctorate degree, so, what most residency programs are looking for is somebody that once you kind of meet all the criteria as far as being the things that they're looking for in an application, which is GPA, what rotations have you had, what work experience, extracurriculars, and all that. It's really, will we fit in with this person? So if you're at the point where you get the interview, then you really want to be, as personable and be yourself as much as possible.
Awesome.
So throughout the whole process, just remember that is to, relax, not be robotic. Remember, at the end of the day, most places are looking for a fit, more so than just kind of checking off.
Well, thanks so much for being on the Pharmacy Residency Podcast.
Thank you. It was my pleasure.
Support for this episode comes from the audiobook Memorizing Pharmacology, a relaxed approach. With over 9,000 sales in the United States, United Kingdom, and Australia, it's the go-to resource to ease the pharmacology challenge. Available on Audible, iTunes, and Amazon.com, in print, ebook, and audiobook.